The Abidjan-Lagos Corridor Organization, Alco, is an intergovernmental body created in 2002 by the heads of state of Côte d'Ivoire, Ghana, Togo, Benin and Nigeria to complement national responses with a cross-border response to HIV vulnerability among mobile populations and to facilitate the free movement of people and goods. The Secretariat is stationed in Cotonou, Benin. In line with its bylaws, Alco recently organized a high-level meeting for ministers of health and transport of member countries in Cotonou. The chairman, Alco Governing Board and Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu, delivered the opening remarks.
With a transit link to the 5 major commercial cities and seaports in West Africa, which drives 75% of the region's economic activities, 30 million residents population, 8 borders, and annual transit population of 47 million people, we must salute the vision of the founding head of states in creating Abidjan-Lagos Corridor Organization. Since its establishment, Alco has leveraged on the support of the member countries and development partners to implement several health and transport sector programs and intervention in line with her mandate. These interventions and supports have contributed to improve public health response and promote free movement of people and goods along the Abidjan-Lagos corridor. We are indeed grateful for the support of various financial and technical partners, including World Bank, Global Fund, and others.
Speaking further, Dr. Gambo Aliyu commended efforts of Alco over the years and made recommendations in light of new challenges.
The governments of Alco member countries need to appraise Alco activities over the last 19 years and its interventions, identify and promote synergies between Alco and the ECOWAS Commission entities on the one hand, and with the Abidjan-Lagos Corridor Management Authority, ALCOMA, on the other hand. This may require a redefined scope for Alco and strengthening its for better response to the emerging challenges. We need to align the vision, the areas of intervention with the mandate of the organization. It is our collective aspiration that this exalted forum will come up with clear decisions and recommendations to fully harness Alco's potential, sustain its gain over the last several years with a new mandate in line with its new interventions. We must recognize the resilience and determination of the Alco Executive Secretary and his team in the pursuit of her mandate despite challenges.
The Honorable Minister of Health, Benjamin Hongpatin, on behalf of the President of Benin, Patrice Talon, delivered the welcome address.
I would like to convey to you the greetings from our President, Patrice Talon, who has been doing his best to give his populations good health and protection of their belongings. To this effect, the government of Benin is hosting the Abidjan-Lagos Organization Secretariat for the past 20 years, and this is the willingness of the President to support the initiatives of the organizations. Ladies and gentlemen, as a complement to the HIV fight in the sub-region, Alco has contributed tremendously to reduce HIV prevalence among sex workers and truckers. Moreover, through the Memorandum of Understanding in Accra, Alco, with the support of the World Bank, has been able to play the role of observatory along the Abidjan-Lagos corridor. Let me take this opportunity, ladies and gentlemen, to commend the Governing Board and the Executive Secretary of Alco for the tangible results throughout the 20 years of interventions of the organizations.
Covering a distance of 1,022 kilometers and 10 border crossings, the Abidjan-Lagos corridor currently sustains approximately 75% of economic trade and businesses in ECOWAS regions. 30 million inhabitants and over 62 million people in transit, including traders and hauliers plying this corridor on a yearly basis. In light of this high density of human activity along the Abidjan-Lagos corridor, there was need to provide additional cross-border response to national initiatives in combating epidemics, especially HIV/AIDS, and the facilitation of free movement of people and goods along the corridor. For this purpose, the heads of state of the 5 corridor member countries jointly created the Abidjan-Lagos Corridor Organization, Alco, on 30th April 2002, whose vision is a development corridor driven by a healthy population, fully enjoying their rights and moving freely and safely with their goods. With its expertise, its renewed mandate, and its strategic positioning as a tool for promoting development, the sustainability of Alco's gains depends on member states' commitment and expected partners.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
The technical session followed with presentations by Dr. Emmanuel Bonnet, Research Director at the French Institute of Research and Development.
There is an urgent need to have a quick response and see how best we can collect data on the ground to have a dual location of roads that are prone to accidents, and then put it in a server that will be serving to collect these reliable data that could be visualized and that could be seen by the World Health Organization. To collect this road accident data, we developed a free of charge, a copyright-free app, and that helps to have minutes coming from the policemen, coming from the firefighters, and also the health agents. That will help to have a follow-up on road accidents. So we train about 200 policemen in Burkina Faso, 100 in Mali, and about 50 in Benin here. And currently, we have a project that is being developed in Bouaké, in Côte d'Ivoire, funded by the French Development Agency. And you can see here a couple of elements that really describe the series of procedures we put in place.
I just want to bring up the point that waiting for accidents to happen before you report may not be all that we have to consider in this matter. And so there should be a way of preventing, having a model in this app that helps to collect data on hazards that are created on the road that should be either removed or tackled to prevent such unfortunate accidents. My last point is that it will be useful to have some quality assurance mechanism in the app so that we get good and quality data, because bad data is as bad as not having it at all.
I also noticed that in the census for deaths, He mentioned those who passed away on road, but also on their way to the hospital. But I would like to kindly suggest that he should go beyond, because all those who passed away after an accident did not pass away on the way to hospital or on the road. Sometimes they will return home and die home, be out of complications that occurred later. So we have to look to consider that even 1, 2 months, 3 months after the accident.
Federal Road Safety Corps Nigeria has created what we call station offices to ensure that all the local government areas in the country have a presence of an FRSC office who work to address road traffic crashes that will occur and may not be collated because they are isolated. And these officers work in tandem with other agencies, whether it's a health institution, it's the police, it's the correctional organization or hospitals. They work to ensure that we improve in our data collection. And outside the station offices, we have to come up with a response agency, what we call a ZEBRA, which is an ambulance service, to ensure that on a 24 hours basis, whenever you call our call center, which is the 122 national emergency number, there's a response to a crash to help us improve what we collate as data. These facilities on ground has helped us to improve.
The preliminary results of integrated biological and behavioral surveillance survey among fishermen along the Abidjan-Lagos corridor by Dr. Patrice Zakeng.
The key objectives of the study was to contribute to improving the knowledge and the situation of HIV among a fishing community. And mainly, the purpose was to determine HIV prevalence, including other infections among fishing community. And there are other specific objectives that I will not like to state right here. And this is the contextual methodological scheme of the study, mainly 4 stages. In terms of recommendations to planning specialists at the government level and civil society organizations, we suggest that this fishing community should be taken care of in the national strategies during the future drafting of concept notes, especially for the Global Fund, and also draft and implement a minimum package of activity to prevent and manage these fishing communities in their favor, while taking into consideration sexual and reproductive health.
And review of Alco in 19 years by Dr. Fagbemi Abel Aziz, Program Officer, Alco.
The key activities implemented by Alco throughout the 19 years include, in the field of health, HIV prevention activities were conducted. That is awareness raising, testing, STI management, and so on. Alco also conducted activities by providing antiretroviral treatments to HIV-positive patients, as well as primary health care, including family planning. Human rights promotion is another field of interventions Alco has been actively engaged into. Capacity building and at the point of entries was also another activity conducted by Alco. Now, on the transport component, data were collected and analyzed on the free movement of people and goods for decision making by Alco member countries. Surveys and studies have been conducted in the various ports, seaports, along the corridor on key indicators on the condition of road surface. During the 19 years of interventions, I believe there were some difficulties, some challenges. Does it mean Alco encountered no challenges? I think it would be good to address also the challenges, because there are some perspectives. And given those perspectives, if there are some challenges in the past, it will help us to develop strategies to move Alco forward. Actually, the major difficulties are funding and contributions from member states. But this was partially addressed already, because member countries are willing to pay $180,000 instead of $80,000 at the beginning. But currently, it's important to mention that 2 countries have regularly paid their contributions. So this is partly solved. On the other hand, it is important for member countries to pay on due time and pay regularly to enable the organization be operational. And remember, it is important for government to have data that will enable them make decisions. But why is it that once the donor, that is the World Bank, has stopped providing the funds, data are no more collected? And I do believe this is an important and critical point. This project needs to further continue. The other challenge is the $180,000 is enough, but it will not be much. One of the recommendations is that the various governments, through the information units that are being transformed to primary healthcare center, could be used so that the various government can provide us with nurses and other stuff to provide care at the borders.
Some participants shared their thoughts.
The take-home is a better understanding of the collaboration among 5 countries in West Africa, the so-called Abuja to Lagos corridor, which started out as an initiative to jointly handle the AIDS HIV epidemic, especially transfer from country to country. But the mandate is being expanded now to also take care of road accidents, other infections, and communities that live along the entire stretch of the highway, which is a coastal highway. So the take-home for Nigeria is a better collaboration among these countries to control epidemic-prone diseases, road accidents, over and above only just the HIV program.
Ghana, we also started something like inland thing, let me say, in-country one. So when in regards to diseases like HIV and the STIs, we're looking at recently we came and did some survey along the coastal belts, like we say, along this Alco, and then we found out that because it's Ghana, we have a longer stretch of the coastal area, our people in there, we did a study on about 4,000 people. You see, we have about 2,000 people in here. So anything that affects, you can see the affection, or anything that affects people around this corridor will affect Ghana more. So we need to put in more. That's why we have started looking at statistics, looking at studying the area so that we can have a formula. We can inculcate it into policy formulation.
Well, my take-home is to look at what I would call best practices. We look at the presentation that was done on road safety that talked about the app that was developed to ease data collection. That is one key take-home for me. The second take-home is the contribution that was made by the rep from Ghana that talked about the ambulance service that have IT-ready connection so that when you call the ambulances, they can identify the location where you are. Even though we are working towards a direction, but it just means that we need to speed up our own effort to be. Well, I'm happy that they've said, oh, best practice from Ghana, from Nigeria. We need to step up on what we're doing so that we will always be a reference point alongside with, say, Ghana, when we're talking about the corridor within the West African region.
Well, all the
the new activities of Alco are very important. However, HIV is still very important for our sub-region, because if you compare HIV performance of countries within the sub-region against those of the Eastern and Southern Africa, we are lagging behind. HIV is still a major issue for us. It is one of the leading causes of death in the West African states. And so that we have to remind ourselves and ensure that we have commitments by government.
The final communique was read by the Executive Secretary of Alco, Idrissa Kone.
At the end of the high-level meeting, the ministers of Abidjan-Lagos Corridor acknowledged the Abidjan-Lagos Corridor Activity Report covering the period from 2002 to 2021, which was presented in 2022. They expressed appreciation for the quality of the Executive Secretary's report and noted with satisfaction the positive result achieved. Congratulated the Governing Board on the leadership role in ensuring the oversight and monitoring of the project's implementation. Acknowledged Alco's engagement in cross-border response in fighting HIV aims, strengthening the capacity of point of entry for prevention, detection, and the fight against epidemics, data collection, processing, and analysis, and dissemination on trade, transport facilitation, and the free movement of people and goods. As part of efforts to strengthen the organization's interventions, Alco member country members express their satisfaction of the outstanding collaboration between Alco and the ECOWAS Commission, especially the West African Health Organization, and encourage collaboration between Alco and other departments and specialized agencies of the ECOWAS Commission, including Alcoma. Express their commitment to ensure the sustainability of Alco's intervention through continued regular payment of annual financial contributions by member states and the provision of medical and paramedical staff to its border healthcare units at the borders. Recommend that countries adopt electronic road traffic accident data collection. Take note of the revision of the Abidjan-Lagos Corridor Organization mandate and submit it while recommending it for endorsement by the head of state of Alco member countries.
The statutory meeting, held once every 2 years for Ministers of Health and Transport of the Abidjan-Lagos Corridor countries, ended on a high note, after which participants were treated to the rich cultural heritage of the people of Benin with a tour of the National Art Gallery. Followed by a gala.
Covering a distance of 1,022 kilometers and 10 border crossings, the Abidjan-Lagos Corridor currently sustains approximately 75% of economic trade and businesses in ECOWAS regions. 30 million inhabitants and over 62 million people in transit, including traders and hauliers plying this corridor on a yearly basis. In light of this high density of human activity along the Abidjan-Lagos Corridor, there was need to provide additional cross-border response to national initiatives in combating epidemics, especially HIV/AIDS, and the facilitation of free movement of people and goods along the corridor. For this purpose, the heads of state of the 5 corridor member countries jointly created the Abidjan-Lagos Corridor Organization, Alco, on 30th April 2002, whose vision is a development corridor driven by a healthy population, fully enjoying their rights and moving freely and safely with their goods. With its expertise, its renewed mandate, and its strategic positioning as a tool for promoting development, the sustainability of Alco's gains depends on member states' commitment and expected partners.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.